Holly Willoughby, the beloved television presenter whose radiant smile and warm presence have lit up British screens for over 2 decades, recently took a significant step towards safeguarding her health by undergoing a comprehensive MRI scan aimed at detecting early signs of cancer and other potential conditions. At 44 years old, Holly, known for her roles on shows like This Morning and Dancing on Ice, shared an intimate glimpse into this proactive health measure via her Instagram, where she perched casually on the edge of the scanning machine, dressed in comfortable black pajamas that evoked a sense of quiet vulnerability amid the clinical setting. Her caption accompanying the post was both candid and empowering. She described the invitation from health tech innovator Ezra as a kind gesture that led her to this multi-organ examination, capable of screening for over 500 conditions, including the earliest whispers of cancer. As we all know, early detection saves lives, she wrote, emphasizing the profound value of such advancements now accessible in London. For Holly, this wasn't just a medical appointment, it was a deliberate act of self-preservation, offering peace of mind, not only for herself but for her family, her husband Dan Baldwin and their 3 children, Belle, Chester, and Harry, who have been the cornerstone of her personal world. This health update arrives at a poignant moment in Holly's life, following a period of transition after she stepped away from This Morning in late 2023 amid a swirl of personal and professional challenges, including the high-profile departure of her co-host Philip Schofield. Her return to the spotlight has been gradual, marked by selective projects like her Wild Moon wellness brand and occasional TV appearances, all while prioritizing family time in their Hertfordshire home. The decision to pursue this scan reflects a broader evolution in Holly's approach to well-being, one that blends her public persona's emphasis on positivity with a more introspective focus on longevity and legacy. Ezra's service, which she highlighted as a beacon of hope, represents the cutting edge of preventive medicine, an AI-powered full-body MRI that scans 13 vital organs in just 1 hour, with optional add-ons for lung CT and heart disease screening. Holly's endorsement underscores her role as an inadvertent health advocate, using her platform of over 8 million Instagram followers to normalize conversations around proactive screening, especially as cancer diagnoses among younger demographics continue to rise globally. Delving deeper into the technology behind Holly's scan reveals a fascinating intersection of artificial intelligence and human health. Ezra, a company that pioneered this service in the United States before expanding to the UK, employs sophisticated algorithms to analyze scan data, drastically reducing interpretation times and providing doctors with a prioritized scoring system for anomalies. What once might have taken days or weeks to process can now be reviewed in hours, potentially accelerating interventions that could turn a dire prognosis into a manageable one. For a cost of £2,395 for the standard 13-organ scan, rising to £2,695 with the enhanced options, it's positioned as a luxury accessible primarily to those with means, though company representatives express optimism about future scalability. Visions of reducing scan durations to a mere 15 minutes and costs below £400 paint a future where such checks become routine, akin to annual dental visits, democratizing early detection across socioeconomic lines. Holly's participation, captured in that unfiltered Instagram moment, humanizes this tech. She's not a glossy advertisement but a relatable mother and professional woman confronting mortality's quiet undercurrents. This move aligns Holly with a constellation of high-profile women who've embraced similar full-body scans, turning personal health milestones into public service announcements. Kim Kardashian, the reality TV mogul and entrepreneur, has been vocal about her Prenuvo scan, a comparable $2,500 MRI service that claims to unearth cancers and aneurysms years before symptoms manifest. In a sponsored post that blended vulnerability with endorsement, Kim recounted how the technology saved one of my friends' lives, framing it as a life-saving tool in her arsenal against the relentless pace of her empire building. Similarly, supermodel Cindy Crawford has shared her experiences with preventive screenings, crediting them for empowering her to stay ahead of potential threats. These stories, amplified by social media's echo chamber, create a ripple effect. What starts as celebrity self-care evolves into cultural shifts, encouraging followers to question, if they can prioritize this, why not me? Yet Holly's narrative adds a distinctly British layer, grounded, unpretentious, focused on family rather than fanfare, reminding audiences that health vigilance transcends Hollywood glamour. Of course, the medical community offers a tempered perspective on these innovations. Experts like Dr. Daniel Durand, Prenuvo's chief medical officer and a seasoned radiologist, champion the proactive ethos, telling media outlets, "We're trying to give people the opportunity to be more proactive about their health." He envisions a paradigm where asymptomatic individuals arm themselves with data, catching silent threats like ovarian cysts or pancreatic lesions in their infancy. However, cautionary voices abound. Organizations such as the American College of Radiology advise that routine full-body MRIs aren't suitable for the average healthy adult, citing risks of false positives that could lead to unnecessary biopsies, anxiety, and escalating healthcare costs. For low-risk individuals, the consensus leans toward targeted screenings, mammograms for breast cancer, colonoscopies for colorectal risks, over sweeping scans that might overwhelm systems already strained by proven protocols. Holly, with no publicly disclosed risk factors beyond her age and family history, embodies this debate. Her choice is empowering, yet it sparks questions about accessibility and over-medicalization in an era of wellness hype. Reflecting on Holly's journey, this MRI moment feels emblematic of her resilience. From her early days as a bubbly weather presenter on Ministry of Mayhem, to becoming a household name through "I'm a Celebrity, Get Me Out of Here," and beyond, she's navigated scandals, body-shaming trolls, and the relentless scrutiny of fame with grace. This morning, she's leaned into authenticity, launching podcasts on mental health and curating content that celebrates imperfection. The scan then isn't an anomaly but an extension of that ethos, facing fears head-on, not for likes but for life. As she awaits results, fingers crossed for that peace of mind, Holly's story invites broader contemplation. In a world where cancer claims 1 in 2 lifetimes, her vulnerability could inspire thousands to schedule that overdue checkup, bridging the gap between awareness and action. Looking ahead, advancements like Ezra's could redefine preventive care, much as Pap smears revolutionized cervical cancer detection decades ago.